we can. Thank you.
Someone died last night. While you were sleeping, 2 more people died. This morning, while you were enjoying your breakfast, yet another person died. And while you were sitting at your desk this morning, 2 more people died. Every 2 hours, 2.5 hours, like clockwork in Pennsylvania, another person dies. One after the other, after the other. According to the Commonwealth of Pennsylvania, 3,500 people died last year from all the same scourge. That scourge has a name. It's called the opioid crisis. It's not a new crisis. It's been around for hundreds of years. Edgar Allan Poe died from the opioid crisis. Michael Jackson, another victim. Most recently, Tom Petty, a victim. All these victims had one thing in common. All their deaths were accidental. According to a study done in the Northeastern University in Boston, virtually all opioid deaths are accidental. Scientific American looked into it and found out there are 2 main reasons why these accidents are happening. Number 1, plain old ignorance. Because opioids can be mixed with commonly available drugs, like alcohol or certain prescription drugs, and can cause a fatal reaction. The people who are dying, they don't mean to die. Second reason is quality control. Most of the time, they're getting their heroin or whatever off the streets. They're street drugs. There's no quality control. You have no idea what you're getting. It's like walking into the bar, ordering a glass of water, you take a sip, and it's moonshine. This is why people are dying. They're dying accidentally, one after the other. A scourge, a crisis. What do we do? What can we do? Obviously, what we're doing now is not working. Tell the 3,500 people who died last year. But there is a way. Suppose I told you that there is a way that we could reduce opioid use by 75%. Suppose there was a way I could tell you we could reduce opioid deaths by 85%. Suppose I could tell you there is a way we could reduce HIV-related infections by over 90%. Would you be interested? I know I would. Because this has happened. According to the Portuguese Health Ministry, they have accomplished these goals. They had a very modest proposal, a very counterintuitive proposal which led to these dramatic reductions. They eliminated their war on drugs. In 2001, they just shelved it. Instead, they learned something new. They learned compassion. What they did is they instituted several changes, one after the other. First thing, if they would catch somebody with drugs, they wouldn't treat them like a criminal and put them in a cage. They offered them counseling. Everybody now gets counseling in Portugal. In the United States, we get about 10% of the people who get counseling. They offer free methadone to wean them off of these opioids. And they offer free drug testing, so that eliminates the problem with street drugs. When they do catch them, they don't put them in a cage. They give them a traffic ticket. And every ticket comes with a free social worker to help them over the hump. In the United States, we spend over $10,000 per household in order to treat drug problems, opioid problems. Do you know how much it costs in Portugal? $10 a person. Huge, huge differences. What can we learn from this? Obviously, we can learn that we're on the wrong track here in America. I'd like to sum it up best by something that the New York Times said. Quote, "The lesson that Portugal offers the world is that while we cannot eradicate heroin and other opiates, it's possible to save the lives of drug users if we're willing to treat them not as criminals, but as sick, suffering human beings who need helping hands and not handcuffs. A modest proposal, reducing opioid use by 75%, reducing opioid deaths by 85%, reducing HIV infections by over 90%. It's a future that we would want to see, and I think a future we should reach for, and we should do it now before another 2.5 hours goes by. Madam Toastmaster.